also take care of their health. What is in store for them? Our Star Wellness program actually gives up to 20% discount to customers who are taking care of their health and who are submitting their health records to our company through integration with our app, who are, through the wearables and trackables and other, equipments which they are using. If they are submitting their health information to the company is giving almost 20% discount to our customers through the Star Health app. So these are the kind of innovations that we have brought. Of course, some of this is being available with other players also, but what I can tell you confidently is our wellness program is not a standard run-of-the-mill program. It is beyond just wellness. It is also moving people from illness to wellness. That is the agenda that we are trying to drive through our condition management and wellness programs. And finally, friends, coming to the main agenda of today, we are happy to announce that we are launching our home healthcare plan or services in 50 plus cities and towns in the country. What is the home healthcare services that we are offering? This is the service. Basically, we are trying to move customers to understand that everything need not be an admission in the hospital. Sometimes the hospital itself can come to your house and give you all the services at your house itself. So that is the home healthcare service. Basically, it is a service which is, targeted towards increasing the comfort and provide personalized care at the home of the patient. What are the diseases that we are covering? Most of the infectious diseases are getting covered under our home healthcare program today with almost more than 50 cities. These 50 cities cover 85% of our population, of our insurance customers. So almost 85% of the customers are now able to avail these services. It covers all kinds of fever, gastroenteritis diseases, urinary tract infections, other vertigo and other things. We are also looking at phase 2, how we can increase the scope of these diseases to cover dialysis, to cover chemotherapy. There are a lot of services that can be covered at home today, and customers feel happy to take these services at home rather than get admitted in a hospital. So this is what we are promoting today. More than 50 cities across the country are getting home healthcare services from Star Health. End-to-end package. It is a 100% cashless facility. Customers don't have to pay a penny from their pocket. And the doctors will come to the house, the nurses will come to the house and provide them these services at their comfort of the house. So the partnerships, this is being driven through some of our partners, of course. So we have tied up with some leading partners who are specialized in these services, and we are able to provide these services. There's a lot of initial traction we are seeing across the country, very well received by our customers. Many customers are already availing of this. And we hope that with such kind of innovations and such kind of first in the industry type of products that we bring, our services will not only be a traditional health insurance services, but it will definitely be far superior.
Within 30 seconds to 1 minute, we pick up the call center. We don't have a waiting time. And within 30 minutes, we call the customer immediately. And then reaching home, it takes about 1.5 hours. And what we do is we specifically pick up cases where there is no emergency there, because all your fevers are not emergency, where you've never seen a patient going in an ambulance to fever at home. So we're very specific in selecting patients where there is no complication, so that they can wait for that 1.5 hours. City kulla vandu almost half an hour 45 minutes la vandrom. Konjam periphery ulla pogumbodhu vandu 1.5 hours agum. And whatever doctor that go, they are qualified MBBS above doctors, nurse who are completed the BSc basic degree nurse, and one interesting point vandu they have been supplied with pharmacy and lab test. Idhukku our patient veliya po venda, they can go out for any of these services, and end to end completely with a package with no out of pocket expense.
Is it an add-on facility or
so currently we are giving this as not an add-on facility, as a benefit without any increase in premium currently. So we wanted to have a pilot project, so we started in almost July, and customers on the Chennai, Delhi, Mumbai, they started to like it. So as of now, it's being given free of cost. And when you saw Tamil Nadu, right, you add infectious disease, which is almost the topmost. Now pay panadile 19% on infectious disease now. Either as a concept, if it goes there, it will help customers and it will benefit hospitals in admitting patients who actually need admission also.
So all existing customers can avail?
Of course.
Without any increase of premium?
Right now. And going forward, we are also looking in bringing in add-ons, the way in which it's going to go. But currently, we are trying to pilot this and give it a free of cost to customers.
How to handle this infection?
It's limited to Star customers for now. But your telemedicine is available for all. But since it's a service where you have to pay some amount to the provider, right? So it's only for Star customers.